Basically, abdominoplasty is most often done in women following completion of their family, and many of these women find that their abdominal skin is loose, stretched with a fair amount of stretch marks, and also the muscles are loose. So in order to remove that excess skin and tighten the muscle, a procedure of abdominoplasty is performed. Hello everybody, this is Dr. K. Ramachandran, Senior Consultant in Cosmetic Surgery from Apollo Spectra Hospitals in Chennai. Today we will be talking about abdominoplasty, a surgical procedure which is commonly being done. Basically, abdominoplasty is most often done in women following completion of their family, and many of these women find that their abdominal skin is loose, stretched with a fair amount of stretch marks, and also the muscles are loose. So in order to remove that excess skin and tighten the muscle, a procedure of abdominoplasty is performed. Abdominoplasty is a surgical procedure, so every surgery does carry a certain amount of risk. But like any other cosmetic surgeries, we have to make sure that the patient is an ideal candidate in terms of height, weight, and then if they have any medical issues, they have to make sure that they are under proper control. Otherwise, I think if a person is a good candidate for surgery, the risks are very minimal. Yeah, we do combine liposuction and abdominoplasty, or sometimes liposuction in abdominoplasty itself. There are two different issues. One is doing liposuction of areas other than the abdomen, like supposing somebody has excess fat in the hips or buttocks or thighs, we could do that. Or if the abdomen itself is having a fair amount of fat, then we could do the lipo of the abdomen, do the muscle tightening and skin removal. Depending on what exactly is the issue, we can address it, provided the parameters are good. Like basically the hemoglobin and others should be good. You can't start such extensive procedures if the patient is anemic or poorly controlled diabetes or hypertensive. So those things have to be taken care of. Typically, a full abdominoplasty is what's called a tummy tuck or the regular abdominoplasty. Mini abdominoplasty is usually like a lipectomy or a removal of small quantity of skin, maybe in the lower abdomen. It's a less extensive procedure, but again, the results also will be based on what we remove. Basically, it's a procedure which is done with 1 day in the hospital, and the patient is made ambulant and he is able to, or she is able to take her normal intake. Once she is discharged, she takes about a week to 10 days for a fair amount of recovery. More or less full recovery is around 3 weeks. So I've just discussed some aspects of abdominoplasty. If you think that you have these problems about which we have discussed, please feel free to contact any of your cosmetic surgeons in Apollo Spectra Hospital close to you. Thank you so much.